Three, two, one.
Good evening. I'm Shirley Johnson. On behalf of the Flint area chapter of the Links Incorporated, I am so glad you decided to join us today. We are here to discuss with you the problem that we have in the Black community of chronic kidney disease. Today, we will focus on one of our initiatives, which is Black Kidney Awareness, Resources, and Education, what we call Black Care. As in these United States, you would not believe, we compose 13% of the population, but we have 35% of the kidney failure. This podcast will help you understand and hopefully close the gap on our health care. Thank you, Dr. Weaver and the panel.
I love it. I would invite anybody, everybody in the city of Flint to come to the McCree Theater before the last performance and enjoy the show. It's so energetic.
Come join us at the new McCree Theater.
All right. Good evening, everybody, and thank you for tuning in. And we are celebrating Black health by tuning into Black Care. And I want to, again, just take this opportunity to thank the Links Incorporated, Flint, Genesee, for having this, because this is an important topic. And you know what? I think we're just going to go ahead and get right into it. But I do want to introduce the people that are here with me to have this conversation. We have Dr. Patrick Hawkins, who is a nephrologist, and he's at Genesee Community Health Clinic. We have Lincoln Ward, who is a successful transplant recipient. We have LaSheila Darden, who I'm going to say is a successful donor, kidney donor. And so we're going to have this conversation because you heard what Shirley said. You heard the numbers and how chronic kidney disease impacts, especially our community. And, you know, I want to get started really with you, Dr. Hawkins, as we talk about this, because, you know, I was looking at some information, and one of the things I read was that this is a silent killer. And, you know, usually when we hear about silent killers, we're talking about high blood pressure, which is a silent killer. But I had not thought about chronic kidney disease as a silent killer, because it says by the time you start noticing it, or we as a people start noticing, we're already in there. So talk to us about this.
I would love to. Let me start off first with, I have a doctorate in nursing practice. I'm an advanced practice nurse. I'm not a nephrologist. I love you guys, but I'm not one of you.
Mm-hmm.
But I have 30 years of experience. I was trained at Walter Reed Medical Center. I've worked with 387 transplants, and I have worked with nephrologists from the West Coast to where we are here. The thing I need you to know, the take-home message, is that 1 in 7 Michiganders have chronic kidney disease. 1 in 7. If you have 7 friends, 1 of you have kidney disease. And it's silent because by the time you notice it or you got symptoms, it's more advanced disease. And because you are brown, you should be aware. And the thing you need to know is, it is not that it's not treatable, because it is. And you can slow it down, or you can slow down the progression of the disease. 2 simple things you need to do when you go in and get your physical, which I hope you go and get. For a simple $40 test, they can check your basic metabolic panel. And for a routine urine dip, even if they don't send it for a urine albumin or protein creatinine ratio, they can dip your urine. If it comes back positive, you know, a dip, you can get, it's 100 in each bottle. I think you worth a dip. We pay for more than that than we do at McDonald's. You can dip your urine, check your blood at least once a year, and track it. The things you need to know is, do I have it? And if I do have it, what can I do about it? You're not a victim. It is when we go looking for it. That's when you need to do them, because African Americans have a higher incidence of obesity, diabetes, and high blood pressure. If you want to help yourself, then you need to know yourself and keep an eye on your weight. Look at your blood pressure. Look at your kidney. There isn't one magic box, one box fits all. What I want to know, according to the National Institute of Diabetes and Digestive and Kidney Disease, nearly 1 in 3 people with diabetes and 1 in 5 with high blood pressure, you have kidney disease. Most of them have no idea that it's going on. It is not that it has to progress. You can slow down the progression and do routine monitoring. And it starts with your primary care. Your primary care provider, that's when you ask. An informed patient is the best patient, because the more you know, the more, when you know better, you do better. And if you're not checking it, who's going to check it?
And you know what, you brought something up, because you said the more you know, the better we can do.
Yes.
And sometimes, you know, as I'm listening to you talk, and what I've heard people say is, well, you know, it runs in my family. And so they feel like they can't do anything about it. It's going to happen to me because this is what happens in my family. But it seems like it's really more related to social determinants of health, not genetics. I mean, that plays a role, but it's those other things you talked about. As far as
it runs in your family. It's up now.
I mean, like not having access to quality healthcare, not having access to foods that we need to have access to. Those kinds of things don't help us.
I'm Southern, and I'm telling you, it's kind of like making a really good dressing. You don't have any cornbread. You don't have any seasoning.
Right.
You don't have an oven. You're not going to have no dressing.
No.
Kidney disease is similar to that, meaning that you have to have the component, your genetic predisposition. That just means that a decade to a decade and a half before that family member was diagnosed, you start looking sooner, because your risks are 2 to 3 times higher than a non-family member. But your social determinants of health are real events. There was an article published in December of 2024 in the British Medical Journal by Michigan State University, and it came from the Flint Registry. Now, I'm not throwing any non-love for my people, but it's 140,000 residents within Flint. Only 14,000 are presented in the registry. What the registry is really doing is, after the Flint water crisis, you want to see if it made an impact or a high incidence of this disease in this population, and this is our population. So what you have to do before the water crisis, in this geographical area, the rate of progression was 2.5 times the national rate, just because you live here. Why? No one has been able to explain it to me. I came in from Seattle in '94, and nobody's explained it to me now. Your social determinants, it sounds like a hook in a popular addict, but I have helped 387 people get a new lease on life with a transplant. I have lost more patients than you have fingernail, toes, and hair. It matters, because everyone is someone.
Right.
And we need to treat them like someone. And you are your brother's keeper and your sister's keeper. Not being biased, and kidney disease is an equal opportunity killer. It does not discriminate male or female. And if you are at a higher risk, then we need to do something about it. And this doesn't mean you're powerless. It isn't. Things you need to do: watch your weight. And smoking affects your kidneys in 3 to 4 different ways. It puts the blood flow in the chokehold. It does some other inflammatory changes to the blood vessels, and it just is not good for you. You need to not smoke. And if you're going to drink alcohol, do it in moderation. Don't go out and ball out every day.
Wow. But you know what? You brought up a good point, because you said we are our brother's keepers. And really, that's why we're here.
Yes.
To bring information to our brothers and our sisters, our community, and be part of that.
Yeah.
And you know, I want to bring you in, Lincoln, because you had been on dialysis.
All 3.
And talk to us about your journey, because you received a transplant.
Mhm.
So talk to us about that and how you're doing.
So far, the Lord bless, doing very well.
Mm-hmm.
I'm 11 years in as far as
Oh,
a
wow.
successful kidney transplant. My journey started not as most as being diabetics, but mine started with something called Alport's syndrome. Alport syndrome is where you have a Y gene you get from your mom, and that Y gene is mutated. And because it's mutated, I mimic the signs of a diabetic. Uh, eye impact, ear impact, urine impact, protein in the urine, and there's one other one that skipped across my mind right now. But that's where my journey started.
Okay.
When I retired, it seemed like everything started falling apart. And I went to the doctor, and the doctor says, "It looks like you may have some kidney issues." He sent me down to Ann Arbor. And that's when I got into Ann Arbor in the kidney program at the time in 2005. When I went there, they found out that my kidney function was down to 26%. And you talk about not knowing.
Did you have symptoms that, I mean, were you feeling a certain
I had
way
no-
or?
Put it this way. It's like we're sitting here talking.
Mm-hmm.
My body's deteriorating.
Mm-hmm.
I didn't know,
Okay.
you know. And it's like the doctor said, it's a silent killer. But if you don't go to the doctor, it stays silent.
Mm-hmm.
So when you go to the doctor, now you have an opportunity to do something, have something done. Even if it's too late, at least you know where you stand with this whole situation. And mine, I probably got, when I got my transplant, my first transplant, because the first one failed.
Mm-hmm.
And it went from 26 down to 10. The doctor told me that if I get to 10, you're going to have to go on dialysis. And I did not want to go on dialysis. But when it dropped to 10, the timing of everything, my son was donating to me. And so that's where I was. I had to take the transplant to try the transplant at that point. It didn't work. And it ended up what do they call it? Not the vent, the urethra, the line that runs for your urine.
Mm-hmm.
It didn't connect. And there's reasons why we think that happened, because my son's in Ann Arbor, I'm in Ann Arbor, two names. We won't go there, but anyway. So we think that some medications was given to him and given to me that shouldn't have been both. So therefore the kidney, it didn't connect. And since it didn't connect, they said, well, we're going to give you some time. We're going to let that kidney stay there and see if it does connect.
Okay. Well,
it didn't. So I ended up having had it removed because it got infected. So that was in 2010. 2004. Now, when I came out, when it didn't work, I had to go on dialysis. That's when I met Doc here. He was a PA at Hurley Plaza 1.
Okay.
And that's where I met him. So we go back a little bit, a little bit. And so because the kidney didn't take, I had to go on dialysis. My goal was to go on peritoneal dialysis, which I'll explain to you.
Yeah.
But I ended up on hemo.
Okay.
And I ended up on hemo for probably about 9 months because I was doing so well and I wanted to go on peritoneal. They put me on peritoneal with the nurse named Cynthia. And when I went on that let me do I didn't like being confined to Monday, Wednesday,
right,
Friday.
You could do it at home.
Yeah. Let me go home. I want to be free to flutter around and do what I need to
in
do.
the comfort of my home.
There you go.
Okay.
So we did the peritoneal dialysis at home. The Lord blessed me to go from the peritoneal dialysis to the cycler machine. Peritoneal, you do it, even though you're in the center, you do it 3 days a week.
Okay.
When you do it at home, you do it every day.
Every day.
Okay. So then I ended up going on the cycler. The cycler allowed me to hook up everything I needed to hook up, go to sleep, wake up, disconnect, drain, fill, whatever, disconnect,
right,
and then go on about my business.
Okay, we're gonna hold it right there because I was listening to you talk about your son was a donor, and LaSheila, you're a donor.
I'm a donor,
and I think you were a donor for your dad,
for my father. Yes.
So tell us about that. What was that like to be a donor, and what did you go through for that?
So I donated a kidney to my father in January of 2008. And, they took me through a series of tests prior to that, stress tests, all sorts of different tests that they wanted me to do to see if I would be a good candidate. I was a good candidate, and we went on through with the process of doing it. For me, it's kind of funny because my recovery was a lot more difficult than my father. My father, after it was over when we were discharged, I remember they wanted him to come. My husband wanted him to come to my house because he felt like with me going through recovery afterwards, that I would be trying to get up and go over and see him, which I would have. So he got my father to come to our house. And my father was going up and down the stairs, looking outside, looking out, he was just enjoying nature and everything, going outdoors or whatever. But for me, I was down.
Okay.
I experienced some significant issues with constipation, nausea. And I remember them saying to me that I should wait at least 3 months before I return back to work.
Okay.
I made the mistake of going back in 3 weeks.
Wait a minute.
Yeah.
Ooh.
Okay. Did that make you do something right there?
Yes, I did. I went. Yeah.
That doesn't hit. That's a mic dropper.
Yeah.
How'd you do that? And why did you do that now?
Because I got tired of being around the house, and I just wanted to get out, and I just didn't like the idea that I was down, but I should have adhered to what was being said to
So
me.
you did this against medical
I
advice.
did.
Let's just put that on the
Yes,
out there.
that was against it, and I don't advise it at all.
Right.
Because they explained to me that by me giving my father that kidney, the kidney that I had left had to compensate
Right.
for the one that was missing and was enlarging. And that's why I was feeling the nauseous, feeling nauseated and having issues with going to the bathroom. And so that was the challenge for me. And he couldn't understand it. My dad kept saying, "Well, what's going on? What's wrong with you? You just laying there, I'm like you. Yeah, I'm looking at him like you just bounced right back. But it took me a minute. I went back to work, and then I realized I needed to take it easy. I was at a job that was very understanding. I didn't have to do a whole lot of strenuous activity, and most of what I did was seated at the desk. But I definitely would say that was something more than what I anticipated. I thought it would have been that way for him, but it was more on my
I
part.
have a question for you, but I want to see if we have any questions or comments from the listeners.
We got Sheena B,
Hey, Sheena.
Miss Jasmine,
Mhm.
everybody saying hey. Miss Teresa, Stephens Lock is watching. Sheena back then said that's actually good to know. Somebody don't know that there are tests you have to request.
And that goes back to what you first brought
You
up
gotta
as
know.
far as the test.
You got to know. If nothing else, just those two alone. Just ask.
Repeat them again.
You want to get a basic metabolic panel, which will give you your urea, nitrogen, and your creatinine. And you want to get your urine, and they can do a urine analysis, or they can do a urine dip in the office. If the urine dip is positive, then you want to get a urine protein creatinine ratio or urine microalbumin protein creatinine ratio, because the basic metabolic panel give you your basic chemistries to include your glucose. And these are relatively inexpensive tests.
And they're not invasive.
They're not invasive.
That's what we want
They're going to
people
draw a
to
little
know, too.
blood, and you're going to pee in the cup. It's
Stuff you do for a physical anyway.
You're going to do for your physical.
Right.
But you want to ask about, even if you have that urine dip, that just gives you a screening. But the urine microalbumin creatinine ratio is more sensitive. If you're going to take the day off of work and you're going to go and get it done, then you might as well go all out. You're going to go all out.
That's right.
If you take the day off and you're going to take the day off, then you might as well get the full Monty and just ask for the big dog. Like, oh, we just usually check, but you know what? I'm brown. I got a little high blood pressure. My Aunt Susie Q got 4 eyes. You want to ask for the test.
Right.
Because I'm gonna tell you, when I got trained at Walter Reed, the only medicine that we are using now that we used then was prednisone.
Yeah.
All the other medicines we don't even use. use. Some of them were derivatives of horse serum. The medicines now are so efficient. They say, well, they don't work on black people. Guess what? They work on, if you breathing, you got blood, they work on you. They got a
So don't let them to don't believe that.
Yeah, they
then.
got a combo. They got a combo for you. You just got to go out and be knowledgeable. And then the ones that we see, if it's to the point where if you have hepatitis C, even if you don't have hepatitis C, and say you need a transplant, we can take somebody with hepatitis C, transplant that good kidney into you, and then treat the hepatitis C because it has greater than 98% cure rate. There are a lot of it's out there that you don't. It's a lot of things you do, and you have great transplant centers in this area. Whether you go into Henry Ford, the U of M, or you want to see one. And what people don't know is when you get to the point when you're thinking about, you don't necessarily need to be on dialysis. You can get a preemptive transplant once your kidney function goes for a certain level. And what a lot of people may not know is that you can be dual enrolled. You can only be enrolled in one transplant center in each state. But guess what? They have a really nice transplant center at the University of Toledo.
I was going to say Toledo.
University of Toledo has a great transplant center. And quiet among the University of Wisconsin, they're very good too. And if you got to say, well, how am I get there? You know what? They got priority tickets for transplant patients. You be on the next thing burning because you got so much time to get there. And there's nothing against the other transplant center. Before U of M, you also have the one out of St. John's. They all have great programs, and they all have to meet the national requirements for certification. It's worth it that hopefully you never get to the point where we having this conversation. The goal is preclude you from getting there. And then once you get there, it's not the end of the world. It's like dancing. So you can't drop it like it's hot. You just get into a nice ballroom dance. You still dancing.
Right.
And you can do it, and we can help you. And there's a lot of agencies like this great program that's presenting it. And if you're not quite sure where to find information, say, hey, Google, National Kidney Foundation.
Yeah.
Hey, Google, American Kidney Fund. And then you can click this great show, and it gives you links. And the evidence on their website will take you to really useful information that can help you. And just like she said, when it is much harder on the donor than it is the recipient.
Now, you know what? That surprised me, like it surprised you.
Yes, it did. Yeah, because I was actually thinking that, more or less he was going to be down because he was taking in a foreign part in his body. So I'm thinking his body was going to have to adjust to it, but my body had to adjust to it being gone.
Right.
And so that was the part that threw me off because I didn't realize that it would take that amount of time.
But you would do it again.
I would do it again. Absolutely. Soon as, and my family, particularly my mom, she was worried about me. My husband was worried about me. They, didn't really want me to do that, but for me, it was an automatic. Soon as we found out that, his kidney was failing, it was an automatic for me to go ahead and do it. I didn't think anything about it. I just knew that I wanted to extend my dad's life. And, thankfully I was able to extend it for 8 years.
Okay.
Yeah.
And you've been 11 years.
11 years.
Okay. What was the difficult part for you? You said that you had to do something again. It didn't work the first time. How did you know it was successful the second time?
Because before you walk out the hospital, you got to pee.
Okay.
You don't pee, you don't walk out.
All right.
Okay. And until that happens, you have that's the first thing. The other thing that goes along with that is you have to know your medications before you walk out the door. They take you through a rigorous test of what medications, what dosages, and those sorts of things before you walk out that door. And you have to know your medications, but not only the name, but you have to know them by sight.
Okay.
Okay. The other part of it was with the first one, like I said, it didn't connect. And because it didn't connect, they wanted to take a chance because they wanted to make sure that they didn't pull it out before it had a chance to connect, and then I would urinate. Okay. But that was the biggest thing. And like the doctor said, the medication that I'm on now, the other thing you need to understand is when you have a kidney transplant, you're on medication for lifetime.
Right.
Okay. I'm on Envarsus, which used to be a medication called tacrolimus. I'm on Cellcept, which is called mycophenolate, and I'm on prednisone. Those three.
Okay.
Okay. Those are with me all the time.
Mm-hmm.
Okay. And anything that you do with those, taking those medications, if you have another medication that's added, I check with my doctor.
Right, to
every
make
time
sure.
I add a new medication to make
Mhm.
sure it doesn't counteract
Exactly.
anything. With most medications, you can't have grapefruits, you can't have pomegranate. And I know those two. There may be another one, but those two for sure, because the interaction cancels your medication.
And it made me think. I remember before we got started, I said, "You're supposed to save that
Yes,
question,"
yes.
because we were talking about medication. She said, I want to ask Dr. Hawkins this right now." So, I mean,
Yeah.
other people might have that question that you
Yeah.
had as well.
So the question that I asked was, why is it that, because I've been told that I can only take Tylenol.
Yeah.
And for me, depending on what pain I was experiencing, a headache or whatever, it just seemed like Tylenol just did not take that edge off. And so I was told I couldn't do the ibuprofen, couldn't do the aspirin, but I didn't understand why. So that's why I was asking you, why is it that we cannot take the ibuprofens and
I'm not going to sit here and tell you, oh, that's a good question, because I detest when people say that.
Mhm.
What I am going to tell you is that it is a simple question with a very complex answer. What happens is the anti-inflammatory components of how that medicine is cleared through the body is cleared through the kidneys, and it can cause other problems. It can cause that fall to that whole COX-2 category. How it cleared anti-inflammatory, not just Motrin. It also carries Aleve. It's a lot of other ones that you can that are in that same category. So if you have kidney disease, you need to tell whoever's prescribing you, like, hey, I have kidney disease, and you can look at your glomerular filtration rate, your kidney function, and it tells you what you should, what's okay for you to try just short term, not every day, long term, and which ones you need to stay away from.
Mm-hmm.
And if you have a solo kidney, you want to stay away from that. If you got declining kidney function, what you don't want to is turn the temperature up in the filtering element of the kidney called the glomerulus. It looks, if an honest answer, if you look in your mind and think about your kitchen sink, if you look at your kitchen sink and there's a big old bowl, and then put a strainer in, that's your basement membrane. And then that plumbing underneath it, those are your tubules. Your kidneys look like that, except you have 1 million of those in each of your kidneys. By the time you get symptoms, you've had to lose about 70. It's about 1 million. You have to lose around 700,000 of them before you get any symptoms. Before you get any symptoms. So if you've already lost about 700,000, you really don't want to invite a bad actor into the category, because it can accelerate your loss of those remaining functions. And if you have one, we want to protect it as much as possible. So they tell you, I just take for a short term. You want to ask. It's better. They tell you it's better to ask for forgiveness as opposed to permission. Not on this one. This one you want to ask. You want to ask. Yeah, you want to knock before you enter that door, because you got 3 doors out there. When you look at it, it's like what's behind door number 1. You know what's behind door number 2. If you know behind door number 3 it's a bunch of bears, I don't know about you, but me, I'm going to close that door. I'm going to put a couple of sticks in front of it, a couple of locks, a big old glowing sign that says, "No, partner, not this one." We stay away from that one when I got 2 other options. And if it doesn't work, we find something else to work for you without that. And that's the mindset you have to have.
And I think
go ahead, and then we'll take a question.
I think it's important to have family too, because my family is on me, and sometimes I be like, them Tylenols just ain't doing it, and they will, say to me, "You're not gonna take this." They are actually rooting me on to not take it.
Mm-hmm.
If I tell them this Tylenol just ain't hitting it, But for the most part, I've been able to stay away from it and not use, anything in addition to that, because that is my concern. But when you are having a headache, it's like, you're like, okay, I want this to go away, but you have to keep, like you just said, remember that the bear is behind door number 3.
Yeah, the bear.
Yeah.
Let's go to a question.
We have a few people on the live. Miss Sandy Etherly Johnson said, "Thank you for this broadcast." B. Marie, greetings to all.
Hey, B. Marie.
Wanda Harden is watching. Tabitha Mars said, "Good information." Now, Daniela Lee said, "Outside of being diabetic and AI Ports disease, what are the other medical conditions that affect mostly people of color and kidneys?"
the hypertension.
Mm-hmm.
There are some cardiac. There you got lupus. Actually, any of the autoimmune disorders is like any, meeny, mighty, mo of the connective tissue disorders, because the lupus will do it. But there's varied forms of lupus, whether it affects your kidneys or not affect your kidneys. It's different ones. And there are some that are really aggressive, and there's some that are not. So any of vasculitis, any of the autoimmunes, that's cover your vascular sources, where the lining of your body attacks the blood vessels, and you have to watch those. And those are really silent, and they can screen you for those. And when you, especially if you have a first degree relative with kidney disease, go in and say, I had a relative with kidney disease, and they can do a really good screening for you. The screening tests are very good. You want to start looking earlier so you don't find out you have the lupus, you have the autoimmune. Those are the big boys. And you can pick either one of those that you like, whether it's the vasculitis component, the autoimmune component. There's a HIV induced nephropathy, and there is an obesity mediated kidney disease, which is where where your body's immune system is hyperactivated just from the obesity. And that by itself, because I've had patients that were actually on dialysis, they went through and lost the weight through various mechanisms. And I remember two that regained function enough to come off of dialysis.
I've heard, I have heard of that. And I
Yeah.
wondered, I'm glad you brought that up, because I've heard people say, I'm going to see if mine kicked back in.
You never,
So talk to us about kicking back in.
After 30 years, I've seen it like 10 times, and I've never seen it coming. I never know who it's going to happen to, but does it happen? It does happen.
Yeah.
And I will know that if the better your BMI is, they tell you BMI around below 30. But what happens is it gets more and more aggressive. They won't even, you're likely getting transplanted.
Okay, see, he's talking like a doctor. You better tell them what
your body
mass
your
index.
Body mass index.
Right.
You can Google it. If you worry what your body
People
mass
need to
index,
know.
if you worry about your body mass index is, you know what? It's a free calculator. It takes your height and it takes your weight, and it calculates your body mass for you.
You can get that off your phone.
Right on your phone. If
Okay.
you say, hello, Google, or hello, Siri, BMI calculator, it will pull it up and give it to you. It's a fancy word. Basically, as it boils down, is you have to be aware of your situation. Not mine, not theirs, not his, yours.
Right.
Because your health is a very personal, nobody needs to be more invested in you being healthy than you.
One question I was going to ask, once you donate a kidney,
Yes, ma'am.
in addition to your doctor, should you ever seek any type of follow-up treatment from any doctor that specializes in that? Is that something that would be good to do? Because I go to my primary care physician, but sometimes I wonder, should I also have someone who specializes in this area to see me?
That's a double-edged sword. Most primary care providers, if they know you were a donor, there are some guidelines that apply. And then if you go and you do your screenings, and if your screening's not right, or you're getting your screenings, and you can always ask for a second opinion. You can always say, I've had this, I had a transplant, we had the family history, and no provider is going to feel offended because you asked for a second opinion from a nephrologist. I've not seen one. Maybe they may not see you there routinely every year, but I haven't seen one yet. And I live from DC to Seattle that felt offended, like, oh my God, they asked for a second opinion. It's not an insult. It takes more than one. When you want Chinese food, you don't go to the Italian restaurant. If you want some ribs, you don't go to the taco joint. When you want ribs, you go to the rib joint. When you want tacos, you go to tacos.
Yeah.
If you want your kidney, you go to the nephrologist.
Yes. Yeah.
Okay.
But it's so hard. Really, it's really hard for me to find good physicians. So there's always something in the back of my head, like, is this doctor missing something? I think that's kind of why I say that sometimes, because, so I'll have blood work and it'll be done and it'll come back. And I'm like, okay, this is in a red area. What do I need to do? And I've been told I'm fine. But I'm like, I get concerned about that. And that's why I asked about that.
Then if you're concerned, you need to go
to somebody else.
You need to ask.
Yeah.
I mean,
that's a very good question.
Yeah.
The position that I practice from, if it's a concern of you, then it's a concern. If it's enough to concern you, it's enough to concern me.
Right.
And then we teach you, because sometimes those biomarker that says red or yellow may not be applicable for you because you are a donor. It may be out of range. Doesn't mean it's necessarily bad. It may just be out of range. But you sit down and you, when you go in, you see one of your providers. I recommend for you on your phone, for those of us over 22, you get a 3x5 card and write down your three most important questions. Three. Your provider can get to three and say, these are the three most important things that I want to cover during this visit. Because as you get there, you say, I'm gonna remember, and then you get there and you don't. That makes us human. And all you start having secondary conversations and you miss out on it. And the thing is, your provider, whomever that might be, if you sit down and say, these are the things that concern me, they went through this training because they want to help people. They do. That hopefully at the end of the day, that's why you do it. And then we have great things like our hosts who are doing it where knowledge is power. That is the most important thing I can give anyone who's listening to this program. The best thing I can give you is to tell you, you don't have to know everything. You just need to know where to look to go try to find it, so you're more informed. And those are good resources. The flyer they have for Black Care, it is different. You do accelerate. You do it it is a proven fact that it happens to Black people at an accelerated rate for a myriad of reasons. The most important health provider you have is the one sitting above your shoulders. It's for you to impart great things in it, look for the resources. And then when you go in, you have these conversations, say, this is what's concerning to me. Because my good man said, I wasn't even going to say it. He put me out there like, oh yeah, I remember you from dialysis. But, it's what you gotta put in. You got to put in some knowledge. You got to put in some weight. And then you go in and you utilize the community resources, because somebody needs to tell you, hey, this isn't just, this is not a meme. This is really important. And if you've ever seen anybody going through it, I have had call enough, you don't want to be there at 3 o'clock in the morning when I was doing acute dialysis. You don't want to see me at 3 o'clock in the morning. That means the bears are out and you're having a bad day. The goal is, so these nice people that's sitting here, we can meet you on these occasions and not under other circumstances.
Right.
And I want to ask you something, but I do want to go back to, we need to be comfortable with our care providers. And you need to be, because I know how Black people are treated sometimes, and sometimes we are not taken seriously, and sometimes we are not listened to. If that's how you feel, then you need to keep looking.
We can tolerate pain.
Right. We tolerate pain differently than others. So we just, because we know everybody in you, as far as, I'm talking about the care. Caring about us,
regrettably,
and that's just a fact of being Black, y'all. But I do want to say something, because you were talking about this website, and it's called Black Care, and it's K.A.R.E, which stands for Kidney Awareness, Resource, and Education. And that's why we are here, because this is an issue in our community. And you said knowledge is power. Are you enjoying dancing? Because that was the analogy you gave. You may not be able to drop it like it's hot, but you can ballroom dance. So it's been 11 years.
11 years. And the biggest thing is, freedom is something that, we go through a whole bunch of changes in this world, and we're not free to move like we like to. Okay. But freedom in terms of your health is what I'm getting at. Sitting in a chair with all these other people that are going through dialysis, and sitting in the chair for me was a handicap. I'm too busy and too active in the community.
I got too much to do.
Yeah. So for me to sit there and just go through dialysis and just, I can watch TV. Oh, the other thing was too cold in that room. But that's another thing. But
it is cold there.
The biggest thing for me was being able to get out and be active. I was the big brothers and church and all of this, and just being active. But based on the Sheila, there was a program. I'm not sure if it's still active, but there was a program where if you were not able to donate to your father, you could donate to somebody out in California.
Mhm.
and somebody in California could donate to your fund.
It's still going.
It's
That's
still going.
Mhm.
Okay.
Yeah.
Oh,
So
It
there-
sure is.
there's that program.
Mhm.
Mhm.
The other thing with me with Alports, I have to make sure that my daughter has her son checked, and I have to make sure my son has his twin boys checked,
Okay.
because it could be something that runs, but it may not run every generation. So we have to
Because
make sure they
yeah.
check that out. But I think the most important thing for all of this, for men, I told my daughter, my grandson, my daughter, and my wife, I said, if I sneeze, I want you to know about it. Because too many times do black men sit back, I don't need to go to the doctor. I ain't going to the doctor. And that's the time that they need to go to the doctor. You know, so if I sneeze, I may not be able to say something. I may be incapacitated to the point where I can't talk.
Mhm.
But they ask you, hey, did your dad do anything peculiar? Well, yeah, he did say he sneezed. Okay, well, that
said
gives
they're
them,
gonna know.
that's a marker to give them some point
Mhm.
of reference, you know. And and I got to Ann Arbor because of second opinion.
Okay.
Okay, when it was first diagnosed, it was like, okay, I need a second opinion. And that's how I ended up in Ann Arbor. And I do that. I've done that with a couple of other situations that
Mhm.
I've gone through with second opinions. And you see the life alert,
Right.
stroke, and different things like that. So it's very important for the men, the men, black men, to put their pride on the shelf and listen to their wife, listen to their daughter, listen to their son, listen to their father, their mother, the bear in the room.
Mhm.
Go, brother, get yourself checked
I know
out.
some black men that need to hear
Go
that.
get yourself checked out.
They got a fancy term that you just ticked on. It's called transgenerational knowledge transfer.
Mhm.
And it sounds all swanky, but really it's the thing that, you know, when the elder is talking and they tell you things that they've learned, that you actually listen so you don't have to re-experience it. So you give this knowledge and you transfer this knowledge on. I like when we do a lot of talking, I do a lot of talking about breast cancer for a myriad of reasons. And if I found out that if I teach the grandmom will have this conversation with the daughter, and the daughter have a conversation with the granddaughter, and you get this knowledge transfer about resources. And the thing that I want to be able to hit on the most, if you are in the land of low cash, and I know it's not proper English, I got no cash. If you have no cash, you have financial challenges in this county, there are multiple agencies that will help you, irregardless of your ability to pay. You can go by Hamilton. You can go by the Genesee Health Clinic. You can go by the community clinic. Only thing you do is Google federally qualified health clinic. And the more you make, the more you pay, the less you make, the less you pay. If you come in and says, I haven't seen anyone, I don't have a provider, I don't have insurance, I don't have a lot of money, they can work with you just because you don't have it or you have challenges. And in this dynamic environment, there are a lot of challenges. Nobody gets
Right.
away free. There's help for you.
That's for sure.
There's help for you. There's help for you to get your test. There's help to help you with your medications. These meds are expensive.
The transportation.
And your transportation. If you worry about, I can't afford my high blood pressure medicine, say something. There are different agencies. There's a $4 list at Walmart that a lot of the common meds that you take is done. If you don't have any insurance, no problem. You can go to the Genesee Health Plan. You know, for those of us who pay, we pay a millage for it. You can go in. They have intake people that can help you apply for Medicaid. You don't qualify for Medicaid. You make too much for that, then they can help you with the county health plan, which helps pay for your outpatient stay and the most important medication that you might need. My advice to you is that if you know someone, that generational knowledge transfer, hit the record button. Back that one up. Talk to your people, because 1 in 7, if you got some
We know
friends,
somebody.
yeah, you got some friends.
You just said
one of them got kidney disease and don't know it.
Right.
You could be you
or
are
it could be you.
it could be you. You are the catalyst of your own change.
Right.
That's for sure.
But I like what you said, that those things that we think should keep us from getting health care should not. Those are not barriers, and help is available.
It's there.
And we are our biggest advocates.
You are your biggest advocate. And make no doubt about it, it does not play fair, and the consequences are steep. And in case you wonder, look in the mirror. I'll say it for you. You are worth it.
Mhm. And that the other thing about chronic kidneys, once you have it, you always have
Right. It doesn't go, it's not
regardless
going
of
away.
transplant.
Yeah.
Regardless of transplant, you're always a chronic kidney patient.
Mm-hmm.
You know, and everything that you do, every move you make sure you talk to your doctor. I've got 3 nephrologists that Dr. Saminsky, Dr. Bauer, and Dr. Norman in Ann Arbor, and they see me for various reasons. But find your nephrologist, even if you just go to him one time, her one time, at least talk to them about what your concerns are. And then from there, you can make a determination as to whether your doctor's giving you the right information or it's something jerking you around or whatever, you know, but at least look at a nephrologist, talk to one and say, hey.
Absolutely. Yeah. I do remember you were talking about the number of people you've seen that actually come off dialysis. My dad was one of them. He came off of the dialysis, but his doctor was out of the country at the time, and he was told by one of the nurses there that because he wasn't having any issues with making urine anymore, so they pretty much had told him that he was doing fine. But I remember saying to him as his daughter, wait till your doctor come back.
Right.
Don't if you still got another appointment, you still go. Keep going until your doctor gets back. And he was one that didn't like to sit still either. And he would also say it was cold in that, going in there and sitting. And I would get him plenty of blankets and whatnot. But he got to where he just was like, I think I'm good. I'm ready to go. So, I would just say until your doctor tells you any different, don't ever stop if you're not hearing it from your doctor, because I can remember saying, you got to go to dialysis this Friday. And he was like, I don't have time for that. And I'm like, yes, you do. Yes, you do. Right?
You don't have time for the other stuff.
Yeah.
You have time for dialysis.
And yeah, right. And my dad, he wanted me to be involved. I mean, I had a book. I'm listening to you mention some of your medication. And I remember a lot of those that you mentioned that he was taking, and keeping up with them and making sure that he was taking them and whatnot. Because for him, the doctor, a lot of times when we would go to see the nephrologist, he couldn't understand them. He couldn't really understand what he was. The language barrier. And so he sat in the first time when he was told he had kidney failure and listened to this doctor talk and go through everything. And then when we got out, because I was taking notes, we got out in the parking lot, he said, now what did that doctor tell you?
Right.
And I'm like, I was just glad to be there with him to get that information.
I think that's important that you do have somebody, because sometimes it's a lot of information.
It is.
And it's overwhelming. And you do need somebody else there.
Yeah.
But even with that, if he's not understanding him, doc, slow down.
Yeah.
It's not registering what you're saying. Slow down so that I can understand what you're saying. And it's nice that you're taking notes. But some of that he needs to say, hey, look, slow down. I don't understand you. Or get me somebody if I need a translator, get me a translator. Because it's important for him to get it. It's great that because my daughter's always calling on the phone. When I go to a doctor's appointment, I make sure I tell them each time, I said, when I'm going, you can call. Call while I'm there. If you got questions, ask the questions, because 90% of the time, even with the 5x7, we ain't gonna remember all the questions, because I'll take some notes in my notepad, flash them to my kids, and they'll ask me questions. It's like, oh, I didn't really think of that question. And it wasn't a question that I hadn't written down, but it was a question that came up. So we have to be, and you have to be advocates for yourself.
And that's why it's good, because it goes back to how we started. We are our brother's keeper, our sister's keeper. But what this conversation also makes me think about, and is the importance of organ donation.
Yeah, it is.
Because we need organs.
Yeah, I'm a donor.
Yeah,
I got my name on got donor on my card.
Okay.
My license. Yeah.
Yeah, because a lot of times we don't talk about that, but this speaks to the importance of organ donation, because you wouldn't be where you are without one, and you wouldn't have had your dad for that many years longer had you not been a donor.
Absolutely. Absolutely. And I never regretted it at all.
Mhm.
Never thought about it. And I stayed really close on him about certain things. And why he was really good. He followed his directions of what he was supposed to, eat and drink and stay busy. My father, he at the time owned Saginaw Street Glass Company, and he also was a mechanic, so, and he retired out of the shop. So he was always so used to being busy.
Mhm.
And, me being a part of his life during that time, I treasure that, I was there side by side with him. So yeah, I can even say my dad wouldn't always say mushy stuff all the time, but just before we got ready to go in for the surgery, I asked him something, and it required him to be mushy, and he didn't want to say it. And I told the nurse, "Stop rolling this bed right now and tell this man say this mushy stuff. I want, we don't, but we laugh about that and whatnot. But that is something that I can cherish for the rest of my life, that I played a part in my dad's life. So I'm just very, very blessed and thankful that I had him.
It's like he gave you life and you helped keep his life.
Yep,
so
absolutely.
That's a blessing.
Yeah,
absolutely.
It is. And sometimes fear can be death.
Mm-hmm.
So
that's why we don't go sometimes, because I'm scared of what they're going to tell me. So I'd rather hear nothing.
Exactly.
I'd rather hear nothing. And I know we're going to be winding up, but before we finish, we got just a few minutes. I want everybody to have what do you want people to know? And then we'll go to you, and we're going to close out with you.
I want people to know that it is such a blessing to actually be a person to donate a kidney. To me, the gift of giving life is really something that's treasurable. And for what I did in terms of test and going through those procedures and whatnot, and then it took me a while. I was hard-headed more than anything, but it's not as bad as people think it is for you to donate a kidney. It really is not. So I would say, if you ever have someone in your family and you want to consider that, definitely do that. Definitely do what it is that you need to do to find out if you're a good candidate for your family.
Okay.
And I guess I would say this: if you, it's very important to follow up on it being a donor. We, your father included, we get a packet when we first go on the kidney transplant list. And the first thing they tell you after you get all your paperwork and all that, Mr. Ward, see if you have friends that want to donate. And they give you kidney donating cards, and you pass those out. And maybe somewhere in there, you'll get somebody that wants to be a donor, at least try.
Right.
The biggest thing is we are afraid, because of past histories and different things. We are afraid I don't want to give that man my blood. No, you need to test your blood out to help John or help Jane. And then if there may be some other things, now you may find out some things too because of your blood. But at least you have given that person an opportunity to receive a kidney. Maybe you can't, but maybe you can be a donor for someone else, and tell your family, listen, hear your family.
Okay.
Daughter talking to your son, talking to your wife, talking to your grandmama, talking to you. Quit being hard-headed.
You heard.
Hard head, soft behind.
That's right. That's right.
And sometimes that soft behind causes you to die.
Because this is life and death. That's what we're talking about.
But be a donor.
All right, doctor.
It is definitely life or death. I'll be honest with you. The reason why I worked with nephrology for 30 years is because it is an honor when people trust you with their most valuable possession, which is their life.
Right.
And, I'm a firm believer of the rule of one. For those of you that not be familiar with it, it came to me in the middle of chaos. You only need to make a difference in one person's life, because one is a powerful number. Because you only needed one Mussolini. You only needed one Hitler. You only needed one Putin. You only needed one Dahmer. And we only need one of you to make a difference in somebody else's life. One is a powerful number. You can be the change that you want to happen. and you can be the catalyst for the change that you want others to have. Because if you just sit there and have this conversation with your friends, because remember, one of those 7 friends has kidney disease and don't even know it. Just take after have one conversation to have a wonderful host to have this one segment, one donor, one recipient, one provider who tells you that one. Don't let one fool you. There's a lot of power in one.
There's a lot of power in one. And the other thing is, and because this is such an important conversation, I want you all to share this podcast, let people know about it, because it sometimes this may be what gets them going. This may be what sparks them to say, okay, I got my physical schedule. I'm going to ask for this, or I'm going to go ahead and schedule it. Or maybe I will go ahead and be a donor, those kinds of things. And so that's why we're here.
I'm a donor.
You're, well, I'm going through something to see. So it's just important. And the way this impacts our lives.
I'm on the donor list.
Right. That's what I mean.
I'm an organ donor on my car.
Right.
Yeah.
But that's important. And we want to remind people of that, be an organ donor, because these things don't happen if we don't donate.
Right.
If we're not a donor, you wouldn't be dancing, ballroom dancing.
There you go.
And like we said, and your dad would not have had an extended life,
Right.
Had you not been a donor. So go ahead. We're going to see what.
So the last few, we have Miss Rita Stanley said, good evening, great discussion. Miss Melanie Smith said, good evening. We have Karen Pugh said, good evening. The Bata 100 said, oh yes, Flint needs information on health.
We do.
So thank you, Mayor Weaver, for continuing to keep our Flint community informed on health issues. Teresa Steffens-Locke said, thank you, panel, very informative. Jasmine M said, this has been such a wonderful conversation. We need more like these. Thank you to the panelists, Flint area, Michigan chapter of the Links, and Dr. Weaver and the Urban News Station for providing the platform. We have a Leela McGee Harvey say, great information. Karen Pugh, a lot of power in one room. And then Leela McGee Harvey say, great subject. Oh my God, son needs a heart. Has me seeing this different. Or her godson needs a heart. Has me seeing this different. And then Dewan Ward said, definitely be available to ask questions. Dad has always kept us informed. And we as a family help analyze everything.
Because we are our brothers and sisters' keeper.
Amen.
And there's power in one.
Power in one.
And we can be our biggest advocate, but we need to share with our family, because sometimes we are hard-headed or we miss information.
There you go.
And so I just want to thank the Flint chapter Links for having this, because they came and said, this is an important conversation. We need to educate and inform our community. So let's partner together and do this. So I want to thank you all for helping us have this conversation. And panel, I want to thank you all as well. Thank you all for tuning in, and please like, share, and subscribe. Welcome to the After Hours Print Shop, located in the Floyd J. McCree Theater building at 4601 Clio Road, Flint, Michigan. A minority-owned printing service in your own backyard. Printing, faxing, copying, laminating, and notary services. For more information, contact the After Hours Print Shop. That number is 810-820-3948. They have a grand opening special of 10% off all first orders.